we're really going to focus on states. You know, a lot of times we talk about these big global things that are happening and Fed laws, et cetera, that might impact us. But tonight we're going to focus in on a few states that had some interesting news develop over the last 30 days that I thought was worth mentioning. So the first thing that popped up on my search was that Delaware, yes, that lovely little state on the East Coast, has changed its licensing requirements for dentists that are seeking public health service in their state. So prior to this particular change, you could come in and provide services within the public health and the federally funded clinics for a certain period of time, but you had to go through the rigors of traditional licensing in order to encourage doctors to come in and continue to serve those underserved areas. They are modifying those requirements to make it easier for doctors to move to their state. So if you're interested in public health service and also interested in the state of Delaware, they are actively recruiting dentists to come in to work in their public health clinics. So that's an interesting change. And you know, when you see these things pop up in specific states, you do start to become a little bit curious about workforce issues and if this is only unique to Delaware or if this is something we'll start to see a little bit more prevalent in other states that are trying to bring docs in to do public health service. So we'll be on the lookout for that. Of course, as we've talked about several times on this show over the last couple of months, Election Day is only 2 weeks away. And of course, one of the major issues that has earned a lot of national coverage and also within our dental community is the Massachusetts ballot question number 2 regarding medical loss ratio. I did a whole news episode just on that particular ballot issue. So you can either reference back to that particular news episode or certainly do your own research online. The passing of that particular ballot item has received funding from both the ADA and AGD, along with other dental health interest groups, while those who are against it fall within the insurance industry line. So it'll be interesting to see how the voters take that particular issue in hand. But the bottom line is that that particular ballot issue is to encourage and require insurance companies to spend at least 80% of their gross revenues on reimbursements back to the patient in patient care and or other support services. I do think that's the bit of the caveat there. They can spend that 80% on support or services to the patient, but also technology advancement, training online, patient portals, et cetera. So it would be a misconception to think that that will all go back to patient care, but certainly we're hoping that may increase the reimbursements back to patient care. Another state that made the news this last week, Kentucky expanded its dental coverage to include dental health benefits for adults in their Medicaid program. So now we're starting to see that state-funded programs are looking at expansion of dental benefits along with vision and optometry in their Medicaid programs. I know several states already have dental benefits present in Medicaid and Medicare programs that are being administered by the state, but we're starting to see more get included in that as well. And Kentucky is one that just passed that recently, will go into effect next summer. Here's an interesting story that happened. And as I read the story over and over, I'm trying to figure out how it got to the particular point that ultimately did not go in favor of the dentist. But a deaf patient was seeking care for oral facial pain with a dental office in Iowa and was assured that there would be interpretation services available, which is one of the new federal requirements where we have to offer translation support for those who don't speak English. And I imagine sign language also falls in that category. The patient was assured that support would be present for the day of surgery and consent. Patient presented. There was no one available to speak sign language at that particular visit. At some point, 7 teeth were removed. The patient did not understand or know what she was consenting to, filed a claim with the Department of Justice, and the dentist settled at $45,000 back to the patient. So I'm not really sure what the lesson here is, except that there are federal mandates out there that do require dentists to provide translation support services for patients. That's not unique to dentistry, that's in medicine. And if you don't have adequate help during that particular visit, perhaps pause or come up with an alternative strategy. And maybe we can learn a little bit from how this Iowan dentist found himself in a bit of a sticky situation. So I thought that was kind of an interesting story. Lastly, for all you California dentists out there, you can no longer drug test or discriminate against your staff members who are doing off the job use of marijuana. So if you have patients that are doing recreational use of marijuana or medicinal for that matter, as long as they are not using it on the job, you cannot fire them or administer random drug testing as a form of dismissal from the practice. So I think that's really important because I know a lot of dentists do implement drug testing either on an as need, random, or required basis. And in California, marijuana is no longer a substance in which you can remove an employee from your practice. And guys, that is it for the news. I do have to tell you, again, we're still in the heat of governance. So in a couple weeks, I'll be heading off to the AGD House of Delegates where we'll be discussing lots of fun issues, but also just a great opportunity for really important leaders and great minds within dentistry to get together and continue to move our profession forward.